Hi, my name is Nate Jones, and today I'm going to do a video talking about the use of tourniquets. There's lots of evidence out there that really supports the use of tourniquets. There's lots of people out there using tourniquets. Not only are you seeing tourniquet use in EMS, you're seeing it in industrial situations, and police officers are carrying it. The statistics have been really crazy lately with people attacking police officers and accidents happening. I want to direct your attention to some statistics here that really get me excited about teaching about tourniquets and giving you this opportunity to understand a little bit more about tourniquets and why you should think tourniquets first, okay? This here is one of my visual aids. This is firearm-related fatalities from officers. So as of December 29th of 2016, we were at 56% from 2015 in firearm-related fatalities. Okay, so 41 officers were shot and killed in 2015. Okay, now in 2016, that number increased to 64. That's a 56% increase in 1 year of officers being shot and killed on the job. So I have a focus to go out and teach police officers and civilians and anybody who might be in the role to use a tourniquet first and save somebody's life. A person can bleed out in just a couple minutes. And if your ambulance is a few minutes away, or you're in a rural area where resources are limited, then this is why I want you to think tourniquets first, okay? 59% of those officers that were killed were wearing their body armor. So these numbers are staggering, and it just blows my mind to think that officers are being killed every year. 135 officers were killed last year for all different types of reasons. But if we can just save one or two of those lives by using tourniquets and thinking tourniquet first, that's what my goal is here, okay? The evidence that I found is they did two big studies. In 2003, you had a war, Operation Iraqi Freedom. And then again in 2006, you had a war of Operation Enduring Freedom. So they took these two wars and they took 500 people from each war and they did a very in-depth study between the 500 people. It was actually 500 and 496. But they took the evidence between those 500 people and they compared them to see if they could find support for tourniquet use. So one of the things I want to get across to you is that tourniquet use stops life-threatening bleeding. Think tourniquet first. Okay, I want to direct your attention to one more visual aid here that just kind of goes over the two studies that support that. Like I said before, Operation Iraqi Freedom in 2003 versus Operation Enduring Freedom in 2006. An in-depth review of the two groups revealed 6 tourniquets were used in 2003. Now this is specific to extremity injuries, specific to the same type of patients in war, getting shot and killed with extremity injuries, gunshot wounds that we know they used tourniquets on. They used 6 tourniquets in 2003. That number was doubled in 2006. They used 12 with the exact same scenarios. In 2003, they had 4 deaths. That's 29% of the deaths from extremities and gunshot wounds. Now, in 2006, when tourniquet use was doubled, okay, they had 12 cases where tourniquets were used in the exact same scenarios, and there were 0 deaths. So even though the numbers are small, there's an increase in survival rate by the use of tourniquets. And it's very difficult to find these statistics because tourniquets and traumas and explosions and all this traumatic stuff, there's so many variables. But they looked at the age, the rank of the officer, the types of situations they were in, the types of injuries, the mechanism of injuries. their health status, they tried to narrow it down as best they could, and they found these results. So there's a obvious results. In 2006, there were 0 deaths for those same scenarios and same situations with double the use of tourniquets. The other thing that I want to talk about is tourniquets are not only used in that situation, they're used in situations in surgery to create a more clean environment, to a bloodless environment, so the surgeon can actually see what he's working on and do more for the patient. So with that bloodless environment, you have a cleaner work environment, you can produce better results, and there's evidence to support that. So I'm excited to say that I want you to think tourniquet first. Use it in bleeding control, whether you're a first responder out in the wilderness saving somebody's life, and you just happen to be there, or whether you're a healthcare worker working at the bedside in a surgical situation. Maybe that's not going to be the first thing that pops up, but I want it to be the first thing that pops into your mind. Hey, we might be able to use a tourniquet. If we have less blood flow to this area, we can see better and we can perform better and get better results. The other thing is that it saves lives, and I just want to thank you guys so much for letting me tell you about this and give you the passion that I have, and hopefully you got a little bit of information out of this, and you can see that if you think tourniquets first, you may be in a situation to save somebody's life. Thank you.